Hi, welcome to the Healthy Campus Research Consortium 2022 conference. Today is the first day of our 3-day conference, and I am Sarah Colby. I'm an associate professor at the University of Tennessee in the nutrition department. First, I want to welcome and thank you all for being here. This is a conference where we can share ideas about research programs and policies, all about health on college campuses. This is a unique conference designed to bring together a wide variety of people, including students, researchers, faculty, staff, administration, community members, policymakers, health and wellness educators, and professionals in extension, healthcare, public health, industry, government, agriculture, and education, so we can all work together to improve the healthfulness of our college campuses. I love the work I do because I believe it can really make a difference in people's lives. And I get to work with amazing people like we have here today who can also care and believe that together we can make a difference. The college campus is a unique and important environment. So many of our young adults go to college, and so much of their lifetime health is formed and impacted by the years they spend on our campuses. The work we do today to improve the healthfulness of college campuses across our nation can impact the long-term health of our nation. I know I'm not the only one who believes this. I have the honor of working with a group of researchers who make up my beautiful academic family and who are members of our Healthy Campus Research Consortium. This is a USDA multi-state research team, and you can see here this list of phenomenal researchers from universities from across the nation who've been working together for many years to develop the tools and materials that will be presented during this conference. I also want to especially thank the USDA, who has funded the previous research that made the development of these tools and strategies possible, and who provided the grant funding for this conference so that we can take this work and make it available for free to the public to use. Beyond this funded research project, I personally am thankful for everything the USDA does to support community economic development by embracing and encouraging innovation so that all Americans can thrive, and to work towards systems that preserve and conserve our natural resources and nourishes all Americans while helping to feed others around the world. I feel extraordinarily lucky to be even a small part of this worthwhile pursuit. So what we do here in this conference and afterwards with these tools matters. In that spirit, the overall goal for this conference is to share with you what our multi-state team has developed and validated. These tools can be used in research and or in program development and evaluation. They can help us to understand, document, and track factors associated with the healthfulness of a college campus. Together, we can discuss how these tools can be used and what the outcomes can be used for. So as you see these presentations over the next 3 days, I encourage you to think about what you might use on your own campus. You will have access to all of the tools, and if you use the links that we provide to collect your data, we will give back the data to you, de-identified, of course, so that you can use it in your own research with your students, maybe in classes, or to develop programs or to evaluate programs. If you decide, you could track the same data over years so that you can identify changes as they occur on your campus. We plan to have another conference next year that would provide you with the opportunity to share back what you have found on your campus using these tools. We also hope that this conference can provide a network, an opportunity for you to build new collaborations as you meet others also interested in conducting research and or promoting health on college campuses. Another thing you will notice throughout the conference is that you will be provided with examples of how health promotion can be integrated into everything we do. We will have slides in between sessions that will be encouraging you to think about setting some personal health goals. And we also encourage you to participate in our activity breaks throughout the conference to keep developing your own personal wellness. An empty cup does not have anything it can share with others. Before starting to share the tools that I've been talking about so far, I want to cover some brief housekeeping points. Here we have some of our virtual ground rules written out. First, when there is not a presentation going on, you're going to be seated at this virtual table. And even if your microphone and video are off, you will see that you are not at this conference alone, that people will know you're here. Hopefully, this will help you feel connected with others throughout the conference. After this opening session, we'll be breaking into small groups for discussions. After that, if you want to move from table to table, just double-click on the table you want to join. If you try to join a table and that table is full, you'll just receive a message letting you know that table is full for now. Also, please note that there are actually multiple floors in our virtual conference space. So use that elevator button on the left side of your screen to move between those floors. If you want to see how many people are on one particular floor, just hover your cursor over that floor button and it will let you know how many attendees are there. Please note that these sessions are being recorded and will be made available to all the attendees after the meeting. Also, please use the general public chat for questions that you have so everyone can benefit from your questions and the answers. The public chat is visible to everyone who is here, whereas the table chat is visible only to the members of your table. You will also see that links to PDFs of the handouts and schedule are available. You can find copies of the tools presented here at the conference on the registration website, the nutrition department where you registered. If you have any technical issues, please go to the help desk that's at the top left hand of your screen. If your camera or microphone still do not work, please visit live.remote.co and click on the Need Help button at the bottom left corner. If your screen freezes, or if you continue to have issues, please just log out and try logging back into the conference. Chrome has its own built-in live capturing software. To enable that live capturing on Google Chrome, click on the 3 vertical dots in the upper right corner of your browser. It's next to the URL address bar. There you'll need to click Settings and then select Advanced. To access the advanced Chrome settings, select Accessibility. And then you're going to need to toggle the option for the live caption to on, and then go back to your remote event and then do a hard refresh, which could be a Control-Shift-R for Windows or a CMD-Shift on Mac. So now that we've gotten that housekeeping out of the way, let's talk about what's coming up next. Since the point of this conference is to share with you tools and strategies that you can use, we would like to demonstrate what a modified nominal group technique focus group is. As it is with much of learning, the best way to learn is often to actively do. So in just a minute, you're all going to be asked to join in small focus groups and participate in an MNGT session. As with the other tools and strategies we will be sharing, you can access the instructions for conducting your own MNGT through our UTK Nutrition Department website. At the end of the conference today, we will share back with you the results of those focus groups so you can not only see how this type of focus group can be run, but what some of the outputs could look like. As you enter into these focus groups, I hope you will bring with you not only your own perspectives formed through your own lived experiences, but I encourage you to consider these topics through the lens of others who may have had very different lived experiences. As you will hear about in some of our sessions, and most likely are already keenly aware of, many college students struggle with issues of food and nutrition insecurity. These issues of food and nutrition insecurity are compounded if a student comes to college from an under-resourced background. Being food and nutrition insecure makes succeeding in college that much more difficult. Many college students also struggle with issues involving stress and mental health, especially in this COVID world. Students today have grown up in times of islands of trash, global warming, and ever-impending economic collapse, and ever-increasing cost of education, housing, and healthcare. Amazingly, most young adults I've spoken with still feel hopeful about the future and believe in the possibility of making positive changes in the world. College can be an exciting and challenging time that is formative for almost all who attend. But for many students, the challenges faced before and during college can make college success a much harder hill to climb. Generational trauma, hardship, and inequities can make succeeding at college more challenging than it is for some of our other students. If an individual is a first-generation college student from an under-resourced family and community, or coming to college from a marginalized community, it can be a time filled with challenges that I don't have adequate words for. Everything can be unfamiliar, and navigating systems can be even more difficult. If a person does not find others they can relate to and connect with, if they feel disconnected and not understood, it can leave students at even greater risks for stress and mental health issues, and less likely to succeed in the systems we've created. I encourage us all to think about everything we talk about over these next 3 days through not only our own lens, but from those other potential perspectives our students may have. I think by doing this, we will be able to pursue research and program development with greater health equity and benefits for all of our students. By doing this, we are helping to build a world that will be better for everyone. I hope my words don't just seem dire and instead can inspire us to work together to make the difference we all want to make. I look forward to getting to know you better during the rest of this conference and hopefully for years to come. Also, in the spirit of building new collaborations and relationships, I would like for everyone to spend a few minutes getting to know each other at your tables before we break out into our small group discussions. So if you have any technical issues, please feel free to reach out to us through the help desk at the top left-hand corner of your screen. And as always, if you have any questions at all, or if there's thoughts you want to share, please reach out and just let me know. So at this time, I would like you to take a look around you as you go back to your table and see how many people are there. If you happen to be at a table that has very few people, please consider looking around and joining another table where there happen to be a few people. So we will have the opportunity to engage in these focus groups this morning. So this will take a little bit of work on our part. We're building a community here. So I will break now and we'll let you get to know each other and introduce yourself and move around and chat at different tables and find a table to be at for our focus groups. Thank you.